Well, the Health Professions Council of South Africa has reprimanded Limpopo Health MEC Dr. Phophi Ramathuba for her hospital rant. Ramathuba has been summoned by the Health Professions Council after a video of her ranting at a foreign national patient at a health facility in the province. Several organizations have said the sanction is a little too lenient, though, on Ramathuba. Let's get some reaction now from Health Justice Initiative researcher, Dr. Marise Richter. Dr. Richter, thank you so much for your time and thank you for joining us on our program this morning. Very quickly, your thoughts on the response from the council, essentially saying that the MEC's behavior was, unbecoming behavior, unprofessional conduct, but seemingly stopping there, not going any further.
Thanks for having me this morning. We welcome the finding by the Health Professions Council, and I think it's important to note the relatively short amount of time that elapsed when the complaint was made in August last year and the finding now in February. And I think that sends a sign from the Health Professions Council that they took this issue seriously. We know that some complaints, like the one against Wouter Basson, the head of the biological warfare project under apartheid, that hasn't been concluded in the last 20 years. There's been complaints against anti-vax doctors that haven't been concluded for the last 2 years. So the fact that the council finalized this complaint in 6 months shows us that it took it seriously. We didn't feel that the sanction went quite far enough. It's laudable that it's seen that she's been sanctioned by the council, but we believe that there were other options under the Health Professions Act that the council could have taken, like a temporary suspension, a fine, and perhaps even professional service that we think would have been more appropriate under these circumstances.
I mean, we know that the MEC is a political appointment. How much of that do you think sort of was perhaps even considered by the council itself, the fact that this is a political appointment, it's a political office, and perhaps may have subdued their response when it comes to some sort of punitive measure against the MEC?
So the council's mandate is quite narrow, that they have to look at the ethical obligations on healthcare professions. And because Dr. Ramathuba is a medical doctor, they could look at the ethical guidelines around the values that health professions have to exhibit in their engagement with patients. So they would be guided by values like truthfulness, having the best interests of patients at heart, and those guidelines, I think, are quite narrow. I can't comment on the political nature of the complaint because I'm not sure what the discussions were with the Health Professions Council. I believe that Dr. Ramathuba needs to be sanctioned by employers as well. She's a public servant. She's a leader in the health department, and her employers need to send a message that xenophobia has no place in the health system and neither in South Africa as a whole.
Well, in defending her remarks, Dr. Ramathuba has repeatedly said that she was merely reiterating frustrations that have been voiced by medical doctors working in public healthcare facilities who have come to her, inundating her office with issues of, facilities being overwhelmed by the number of foreign nationals coming seeking medical care and attention. Now, without necessarily going into the veracity of what she's saying, talking to the idea that there are medical officers approaching her office bringing these allegations to the fore, was there a better way in which she could have handled the information that was being brought to her?
I think a complexity that's important to highlight here is that the Limpopo Department of Health is under a lot of strain and has a lot of problems. There are instances of mismanagement, of corruption, and it's clearly brought out in terms of official complaints mechanisms or regulatory bodies. The Auditor General has now twice in the last 2 years given a qualified audit of the Department of Health's finances. We know that the department is facing medical negligence claims of over 14 billion rand. So clearly there are structural problems within the department that need to be addressed with great urgency, and that needs principled leadership, which I don't think the doctor is providing to the department, and that it's very convenient to scapegoat migrants for these problems, while there are much more pervasive problems that need to be addressed. So I have a lot of sympathy for healthcare workers who raise the complaints of working conditions, but these need to be approached in a very systematic way with mechanisms that are available within the national and the provincial departments of health.
Yes, but Dr. Richter, are those mechanisms, are those systems working effectively? And I want to bring, closer attention to the Health Professions Council itself. You mentioned, the quick turnaround time with this particular issue, but that there are other issues that are still lagging. Issues, as you mentioned, concerning Wouter Besson and the apartheid-era medical crimes that he committed. And so I'm wondering if, doctors are, faced with this, mounting pressure, frustrations, these working conditions that are untenable, but the systems in place and the mechanisms in place there to help, to ease, to offer assistance, are they capacitated enough to handle what's happening on the ground when we look at our health industry and more critically, I suppose, the public health sector? Yeah.
I think your comment is very fair. I think health professions are under immense amounts of stress and pressure. And I think in health professions, speaking to the head of their provincial health department in Limpopo and raising these issues are a very important first step. Dr. Ramathuba needs to be able to address these issues at their source, the underlying broken healthcare system, and apply political pressure and her influence as the head of the department to solve these. She shouldn't be in a position of blaming migrants, and certainly not shouting at a migrant patient in the Bela Bela hospital. So I think her reaction to these complaints to divert attention away from her responsibility, I think is very serious misconduct.
All right. Well, Dr. Richter, thank you so much. We'll leave it there for now. That was Dr. Marise Richter from the Health Justice Initiative giving us their reaction there to the Health Professions Council of South Africa's reprimand of Limpopo Health MEC Dr. Phophi Ramathuba.